I'm Rob Ploutz-Snyder. I'm the Associate Dean for Research in the Office of Health Research here at Wayne State University College of Nursing. For me, it's about team science, building good teams, right? Whether it's my own research, where I'm trying to recruit people in to help me do the work I'd like to do, or somebody else's research where they're really needing to fill their team so that they can be really highly competitive in winning grants that are usually necessary to conduct the research. Research is expensive, no matter what your content area. And then when those teams are together, they can actually get the work done in a meaningful way where my weakness is filled by your strength and vice versa. So that at the end, we have this winning team, right? That can really collect strong data to answer scientific questions that are helping people's lives. Some of my personal research interests now are dealing with the opioid epidemic. I got involved into this by collaborating with a person who was really a qualitative researcher. That's not my expertise. I'm not a qualitative researcher, but she approached me because she was really dedicated to working to understand what can we do in the opioid space in particular to reduce fatal overdoses. She was a qualitative expert who could collect information that would help us understand qualitatively the issues and the potential solutions. And I was a quantitative person. We began collaborating together, and it's been a real challenge. And I think that's part of what's attracted me to it. So I had to learn how to do community-based participatory research, where we're truly teaming up with community partners, people who might, say, deliver harm reduction tools to help people who are struggling with addiction or just using drugs, keeping them alive one day more. We recruit people, we randomize them to treatment A or treatment B. They follow a very specific protocol, and we collect data on them during that time. And then we compare outcomes. It's the gold standard of research, but it's not necessarily realistic for all contexts. And drug use and drug addiction is one of those areas where it's pretty hard to use that paradigm. So instead now we're partnering with institutions and groups out in the community who are dealing in the trenches with people who are struggling with drugs. How can we collect data that would be useful? What data would be useful to you? What kind of interventions do you think are helpful? And then we can try to implement. We can bring to the table some of the evidence that suggests maybe this might be a helpful approach. What do you think? It's very collaborative in nature. It's something that's really different for people who have grown up through the principal investigator driving the entire ship. So now you have to co-pilot that ship with people in the community so that you design protocols that'll work, that we can implement, and we can actually test the implementation. How well does it work? Maybe what we thought would work needs to be tweaked a little bit, or maybe it won't work at all and we have to completely pivot to something else. We're trying to implement things where there's evidence behind it that are going to work. And right away, the research participants that are doing work with us are benefiting from this. Each step along the way, we learn how to do a little bit better, but right away from the very beginning, it's impacting communities and the people within those communities. And that's a real attractive feature for me. One of the great things about Wayne State College of Nursing is that we have very complementary groups of people trying to do their scholarship. We have folks in the clinics that are delivering patient care, bedside patient care. They have access to patients and they see what's working, and they also see what's not necessarily working as well as it should. So they can come up with some phenomenal ideas. And then they can team up with some other folks who might say, understand some of the genetics of that, or the epigenetics, or some of the biopsychosocial aspects of it. And they can also then team up with others who have real expertise in experimental design or research designs, quantitative or qualitative. So we have all of these pockets of people with different expertise all in one space. And the culture here is very collaborative. So it's kind of like the perfect storm, right? Of getting people together to answer a complicated question where each member of that team is providing a critical component. The team couldn't do quite as well, or maybe they couldn't even do the project if they weren't teamed up together. But now that they are, we can do good things.